Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
This is Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you're listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Thank you for joining us for this podcast series topic on patient education, creating teaching moments in practice. Today, I am joined by Dr. Kim Marignac, who is also the author of our continuing education course on patient education. Thank you so much for joining us, Kim. And did I get your last name right?
It was so close. It's Marignac, but that's okay, Candace.
Okay. Well, I would really love for you to kind of start us off with introducing what are teaching moments and what is the significance of teaching moments?
You know, teaching moments are those times, and they literally can be, very brief or, a little bit more, when, the patient needs to have education. And when I say patient, I also mean patient and family. But those are the times, we have sort of the formalized expected teaching moment. So, we know we're going to have to teach about discharge, and there are certain things that we have to teach prior to that. But then there's those informal, spontaneous teaching moments. And those are, the times when we have to recognize that the patient, or family needs to have education in the moment. Say, for example, a new medication or, something new that has happened, they have to have that information.
Absolutely.
So it's really, those times when we have to help them out, and that's part of nursing.
So teaching moments they can be planned moments or they can be unplanned moments, but it's really that opportunity where everything comes together, the emotional aspect of it, the cognitive aspect of it, and you're able to help them understand. So learn and be able to use what they're learning also.
Absolutely.
Kind of that learning piece of it. So why is it important? Why are teaching moments important? The moment when we teach, why is that important?
So when we teach is important because, like you mentioned, there's, cognitive piece and there's, emotional piece. So making sure you're teaching when it is appropriate is also important. If you have someone who is emotional and in distress or in pain, or there's, other things going on, that's obviously not a good teaching moment because they're not going to get what they need from the conversation. The importance of, teaching moments is to make sure that you are addressing the needs of the patient and families with this teaching. They
Absolutely.
have to have the information because, number one, they're part of the healthcare team. And so for them to make effective decisions regarding their health, they have to have the right information. And plus, it does help them, like when we talk about beyond, that moment, they need to know what they need to do and why. That's a big thing, to help them, as they grow in their, health and wellness.
Absolutely. And one of the things that I really want to get into this time is nursing students, our new nurses coming out into the workforce, but even our seasoned students. Do you feel like they're really prepared for this? I feel like this is such a foundational part of what we do as nurses, but I don't know that I was prepared when I was a new nurse, when I was just getting out of nursing school. And now, I've been in education since 2015. So,
right.
I feel much more confident in what I'm doing. But before my education, I didn't feel confident in what I was doing.
There's so many factors that contribute to that. One is, are you comfortable communicating in general? And I think that, our newer nurses, that is a skill that they're still learning. They don't really have the time in nursing school, to have those experiences and have those effective communications with patients and families, particularly those that have gone to school, kind of during this pandemic, because there was so much of the simulation, and simulation does not give you the full experience. And then the other piece is, are you confident in what you're teaching,
Right.
and how do you know what to teach? So, there's pieces of the, using the nursing process. You have to be comfortable with that. And and I think that it is scary for new nurses. They have to realize, like, you don't need to know everything, but you
Right.
do need to know the resources to make sure that you're giving the information for patients and families.
You need to know what you don't know. Like
Yes.
that way, you know when you need to go find that information before you share it. Because I feel like consistency and what we teach, sometimes patients don't have that. So they hear something from one provider and then they hear something from another. That leads to confusion. That leads to a lack of trust in the
Yes.
healthcare system. So definitely knowing what you don't know. It's okay to say, I don't know. Let me go look it up. Let me go
Yes.
ask.
Yes. And like you mentioned, I mean, trust is an essential part of the relationship between, patients and families and the healthcare, professional, whether it's the nurse or the provider or,
Right.
therapist. And if you make things up or you don't really know and you just kind of blow them off, that really does affect trust. But it's okay to say, I don't know, but let me go find out,
Right.
because that makes sure that they understand you are being vulnerable and transparent, and you're a human being and you care enough of them to give them honesty and then come back with what they need.
Absolutely. Let's talk a little about the benefits of providing proper patient education.
Sure. So, like I mentioned, especially with our, more formal planned education, we make sure that they are getting what they need. So, and there's certain things that we have to teach. We have to, for example, adults, we should be talking about smoking cessation and how do you recognize signs of, stroke and etc.
Right.
Um, but there's also those other things. So if you have a new diagnosis, you have to make sure that you are teaching them what they need to know about that. Diabetes is a great example. They have to understand, and again, you don't have to get into the pathophysiology and blah blah blah
Right.
because you overwhelm them, but the essentials, what does this mean for me, what's happening in my body, and how can I manage it, you
Right.
know and what to expect.
How can you empower them to be able to take care of themselves with something that we know is going to be chronic and that they're going to have to live with?
Yes, but it has to be effective information. We can't
Right.
we can't be giving them too much or not correct stuff. I've got a great example actually. So once upon a time, I oversaw a diabetes education program, and one of my specialists came in and she told me this story. So a gentleman was in the hospital for something like not related, um, and while he was there, they diagnosed him with diabetes. And anyways, he followed up with her in the clinic, and he came in. He said, "I am just so confused." And so the nurses, before he left, gave him all of this stuff about diabetes. And so he had a book, the booklet on diabetes, and then he had all of these forms, individual forms that talked about blood sugars, insulin, which he was not on insulin, by the way, type 1, type 2, and gestational diabetes.
That's a
So,
lot to weed through as a patient, especially as someone who's not in healthcare. That's a lot of information to try to figure out what is actually relevant to me.
yes. So, that's a great example of, adding confusion to that poor patient,
Right.
because it just, and it scared him. He's reading about gestational diabetes and how that affects your baby.
That poor guy. He was just trying to do what he needed to do to be empowered to take care of himself.
That's right.
Well,
So,
I've also, it's not uncommon too to have diabetic patients who will come in and, we just assume that they've had this disease for, a long time, that they know what they're doing with something like giving themselves injections or pricking their fingers, and you will find a lot of times they're actually doing it incorrectly. So I also think it's important not to assume that they know what they're doing, to take the time to, watch them give themselves an injection, watch them check their blood sugar, to kind of really understand where they are so that you can
Yes.
correct something that they're not doing correctly. So the benefits is empowering your patient with the knowledge to be able to take care of themselves. And just like this poor guy that you're just talking about, he was trying to engage in his own care, but he didn't have the right direction. And the problem with that is adherence to his treatment plan. He probably was so confused, he had no idea. But we know that research shows with proper education, we can have a higher adherence to treatment plans. So
That's right.
and
And
all of
better
this,
outcomes.
yes, I was going to say, and all of this is going to go back to the a decrease in hospital readmissions, into hospital admissions period, higher patient outcomes. So they're able to take better care of themselves. So that's why it's so important to really take time to really teach well. So let's talk about that. Patient education really links well with patient-centered care. And I know that is like more of a hot topic word right now within healthcare, is how can we get care to be re-centered on the patient? So how does patient education re-center back to the patient?
Yeah, you have to look at it as this is not a task for the nurse to complete. This is something that the patient needs, and we have to make sure that we're doing it effectively for them, right? So that's who we're doing it for. It's not for us, it's for them. And you mentioned how like we, teach effectively, and then we also need to follow up and make sure that they have comprehended it.
Right.
And when we do, patient-centered care, it really is, that mindset of this is for them. And, that one of the key pieces, of course, is, assessment and making sure, we mentioned a little bit earlier, is this the right time for teaching?
Right.
How do they learn? Right? Everybody learns differently, and everybody learns differently depending at the time in their life, right? So how do we adapt to that? What do they need to know? So the other thing is, you don't want to overwhelm patients with a whole bunch of information, just like that poor gentleman with 76 pages of stuff. So what's the important things to teach in the moment, and really paying attention to their responses as you're teaching.
Right.
Because if you're overwhelming someone or they're not comprehending, then you need to stop, and it's probably not the best time to be doing it. Get a little piece in there, and then follow up later. So that's why we talk about in nursing, like teaching is from the moment that you meet them.
Absolutely.
Yeah.
So I know you mentioned earlier the nursing process. So the nurse's role, we know that we have a role in patient education. So can you walk us through how we use the nursing process to help us in creating these teaching moments?
So when we, do our assessments again, you are assessing obviously the physical of the patient. So, in terms of teaching, if you have someone who is in pain, or you have, they're going to be going off the floor shortly and we have all this stuff going on, obviously that's not a good time. But you also have to assess emotions and, social support. I bring up family a lot because sometimes you have to have them as part of the teaching too, if you can.
Right.
And assess what their needs are. So when I say that, we have different ways of learning. So we have visual, we have auditory, we have, kind of the tactile and kinesthetic, and asking them, and not just asking them, but doing the assessment of how they best learn in that moment. Because again, some people, they might have combinations and be visual learners and tactile, but maybe in the moment this is a combination one. So going back to our diabetes example, you should not just talk about injecting insulin, you should actually walk through it and have them do it, right?
Absolutely.
So all of that is part of the assessment. And again, as you are teaching, you have to keep assessing, because like I said, if they are not able to comprehend, this is not the time to do it. And part of it too is we have to remember after we have done some teaching, um, we need to follow back and make
Right.
sure at a later time,
Well, I
because you
want
can
to
have,
go
yeah.
I want to go back to that assessment piece. What are some of when we're assessing, doing that initial assessment to figure out that learning assessment is really what we're doing. What are some barriers to the patient that we would assess for, that we would look at? I know you mentioned like that emotional, but tell us a little bit more about those barriers that we might see with our patient that's gonna tell us, you know what, I need to wait, or
Mhm.
we need to work through this before we can actually have a teaching moment.
Right. So there are a lot of things that can affect our patients. We look at so communication, right? If you have a patient and their primary language for learning is not yours, then you need to make sure you have interpreter services involved. So that's one of the barriers. If you have someone who has, visual impairments, then they need to have their glasses. If you have someone who has hearing, they need to have their hearing aids, right?
The
You
TV
need to
off, make sure it's
make
quiet.
exactly. What's the environment like? Because if there's a lot of activities and people, surrounding, you're not going to be able to teach effectively.
Right.
And then the other thing is the literacy, the health literacy piece. So, when we talk about health literacy, it's really how does that person understand what is related to health? You can have someone who has, a PhD and they are a very literate person, meaning that they can read and write and speak. But when it comes to medical, it's a different story.
A
So that's
different
part of
world,
the assessment.
a
Yeah,
different language.
exactly.
Yes.
Yeah, so those are some of the things you have to consider when we're talking about, getting ready for education.
Right. So we've assessed our patient. We understand where we are with all of those pieces. So now, how do we implement our education? What are some ways we can implement?
Well, I always really emphasize teach back. So that is, taking the information and teaching it in little chunks. So again, not, overwhelming and having this, 1 hour, lecture with a PowerPoint.
Right.
But what what is the key information that you have to teach
Yeah.
with the patients and families, and then having them talk, tell me in your own words what this means, because that really is part of that ongoing assessment, so you can understand as a nurse whether they have understood it or not,
Right.
and what you need to do different. And then the other piece is, when you are kind of planning on doing education, again, it doesn't matter whether it's planned or unplanned, what resources do you have? So when I say resources, it's, yes, it is patient information, booklets and pamphlets and stuff, but that should never be a standalone, thing. It needs to be part of what you use as a tool to kind of reinforce what you're teaching. um, Visual aids, right? So if
Right.
you have a patient and they are a visual learner, do you have the ability, draw something? It doesn't matter. You don't have to be a good artist. It's okay. But that does help. Or using, some other tools. So example that, injecting insulin, you can use the old, orange
Right.
and syringe because
Yes.
it still works.
Yeah.
So making sure that you have all those pieces.
What is the difference, the important differences between trying to teach an adult versus trying to teach in a pediatrics patient?
Right. So the big considerations is you have to know the developmental stage. And you don't have to know like your Erickson and Piaget and all that good stuff, but just kind of, that assessment of where they're at. And this also is true for, adults who have developmental delays. So you have to keep that in mind. So depending on the child, the really young ones, obviously, it's the parents that you're teaching, right? So two and less. As they kind of get older, they can be incorporated a little bit, but you also have to look at so attention span. right? The younger the child, the shorter the attention span.
I think adults have that too.
Yeah, well, that is
Um,
true.
I know I do with some things, especially if finances. If you come and teach me about finances, I am going to zone out after probably 10 minutes because
Yes, this is true.
it's just not anything I'm interested in. So attention span is huge. Yes.
Again, with the hands-on works really good for kids, as they're growing
Right.
up. That's part of how they learn. So, having them things for them to hold and touch and practice. And, even as you go in and, if you were doing a physical assessment, having them listen with the stethoscope and, I mean, that really gets them involved. And you talked about empowerment, and that's one thing with children is that we do need to remember to involve them to whatever degree we can.
Right.
Now, obviously, as they get older, like, your adolescents, they really value that because they want to be seen as, independent and can make decisions. And, legally, you still have to have parents, but it's
Right.
so important to have those conversations and make sure that you are addressing their needs.
Right.
And part of the assessment with the children is that, with adults, we can talk to them usually about how they learn and what works best for them. Kids, you kind of have to do just a little bit more trial and error.
Right.
Um, but for the most part, the visual and having things for them to, the tactile piece, that's very helpful.
Right. So we are talking about parents with pediatrics, but when we're also teaching adults, sometimes we find that we have those secondary, the family members, the secondary people that we're teaching. What's the best way to do that while also respecting the primary person that we're teaching?
Right. So, I mean, the first thing is that ask the patients, right? Because when we talk about family-centered care, it's really up to the patient, first of all, to tell you who their family is. We think of family and everybody kind of has a different mental picture. So we have to remember that, families these days, it's not just mom, dad, brother, sister. It could be people that aren't even related, or, marriage. So knowing what the definition of family is for that patient and how much they want them involved is
Right.
essential. And there are also, I mean, there are times when there are legal pieces to it if you have someone who is, legal guardian or something. But so that's kind of number one. Number two, if you can involve the family and the patient at the same time, that is really effective because then everybody's on the same page.
Right.
Um, and it does help the patients, especially if they're in an acute situation, they are probably not going to comprehend as good as someone who's not in their space, right? Emotionally, yes, families are very much involved, but they don't have the physical, pain or discomfort or, all those things going on. Um, and they can help support each other, but it's the same things, make sure that you are assessing everybody, that you are, trying something like teach back, and that you're following up. That's really
Right.
important.
Walk us through teach back.
Yeah. So teach back is, again, you look at the topic and you just want to break it down into small little chunks that the patient, or family can digest, and then have them repeat it back to you in their own words. So, going back to our example of diabetes, you look at, okay, what do I need to teach this patient? Well, they need to know, what is diabetes? What does it mean to you? Like, what does it do to you? And how are you going to manage it? Those are the like key things, survival things. And what do you do in an emergency, right?
Right.
So, I would tell them, a little bit about diabetes, again, using words that are not, medical jargon, because that's not helpful. Having tools, so using visuals, And, if a person is on, insulin or needs to do blood sugars, obviously walk them through that. And then you just ask them. So as you go through each little topic, you just say, okay, so, we just talked a little bit about diabetes. What does that mean to you? And hear a response like, well, it means I don't have enough insulin, and I need to have insulin as a key to get the energy into my cells. And when you are teaching them physical things, so having them, okay, so now I want you to show me how you would do this at home. And the important thing is that when you are doing teach back, it's small, and it's in, little pieces. And you're doing it so that you're asking them, I need to see if I've done a good job. So tell me in your own words. And that way it makes it a little bit less threatening, you know, because you're putting the onus on you. Like, I'm the one that needs to see I did a good job. And having them paraphrase actually really helps with the understanding. Because if you simply ask someone, do you understand? 99% of the time, they're going to nod and say yes, because they don't want to say, I don't know. And I also end like any sort of teaching with the statement, what kind of questions do you have for me? Because that's opening it up and letting them feel like it's okay to ask questions, rather than, do you have any questions? Because that close-ended is cut them off.
Right. Well, Kim, we have come to the end of our time for episode 1, but some of the things that I really want to jump in when we start episode 2 is the open-ended questions. Because, as healthcare providers, when we are tasked to take time to educate our patients, sometimes we feel like this is kind of, we already have a heavy load, and now we have this that we feel like can take a lot of our time that we need to give to other places. So that might hinder us from actually asking the right questions that we need to ask. So I really want to get into that in episode 2. So we hope that you can join us for episode 2, where we're going to delve further into the topic of patient education. Kim, thank you so much for being here for episode 1. This has been so helpful and informative.
Thank you so much, Candice.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.